Hello there, everyone. My name is Kim Sisto. I'm the Director of Clinical Education here at Spalding in our physical therapy program. Thank you so much for coming to this session today. I know that you all have such busy schedules with your clinical duties and everything, so I appreciate you spending the time with me during our session today. I'll try to make it quick and snappy, but please let me know if you have any questions along the way. We really, from the bottom of our hearts at Spalding, we thank you for your service to both our profession and our program. And I'm really looking forward to working with you all, getting to know you better as we share this process and go through this process together of educating students. At any time, if you all have any questions, I want to make this real informal. Don't hesitate to raise a hand or ask a question. I want to make this more interactive. So, just with an introduction to myself, real quick, again, I'm the director of clinical education here at Spalding in our physical therapy program. My background in physical therapy is as a pediatric physical therapist. I have board specialty certifications in both pediatrics and sports. So, I treat pediatric patients with orthopedic conditions and then also pelvic health conditions. I am a native of Columbus, Ohio, grew up a couple miles away from Ohio Stadium, so go Bucks. But everybody gives me a hard time in my life because I went to University of Michigan for graduate school and was at Eastern Michigan for undergrad and did gymnastics there. That was my pull to Michigan, but I get a hard time on both sides. So don't know really why I did that. But anyways, I that's just kind of a little bit about me. I've been a practicing PT for 13 years and then started into academia a little bit over 2 years ago. So our physical therapy program is located in the center of the city of Louisville. We have a beautiful facility, a new facility, where our students come into practice and do their lab intensives with us once a week for every month as we have a hybrid program. But our mission of our program is really to prepare compassionate, caring, skilled, lifelong physical therapists committed to lifelong learning, engagement in their community, and leadership in the profession. So, probably similar to a lot of other missions that you hear for other programs. But we all do love any visitors. Please, 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 if you're ever in the area or have any interest in stopping by, getting a tour, and meeting us in person, we'd love to show you around. And I'm also looking forward to those site visits when I get to visit you all in your space. So here is a picture of our rehab skills lab. This is an area where our students basically learn their skills and those psychomotor skills. But we just feel so lucky to have such a beautiful new facility where our students are able to practice their skills. Our building is over 2,200 square feet. And then we also have a cadaver lab. So a wonderful thing about our program is that our students actually do get to do that wet anatomy and do that cadaver lab. So they do spend a significant part of that, a part of their first semester in PT school doing that dissection. So I'm going to turn it over to our program director here shortly. His name is Jason Ashby. He has a background in teaching and has been teaching for over a decade in PT and PTA programs. And he most recently was at the University of Findlay. His specialty areas of practice are outpatient orthopedics and home care. And he primarily teaches our orthopedics and musculoskeletal content.
Thanks, Kim. Hi, everyone. As you can tell, it's a very old picture of me. Um, I just wanted to stop in real quick and say thank you all for taking our students. You are a crucial piece of our program and of our students' education. I also want to thank Kim for doing such an outstanding job in arranging and directing our clinical education program. Um, so I won't take up any more of your time. Thanks again. We appreciate it. And thanks for your time.
Right. So I'm going to go back into my presentation here. Um, and I just want to introduce you to some of our other faculty members. So our newest faculty member is Catherine Luxus. She's been a physical therapist for over 2 decades and has expertise in gerontology, bone health, and psychosocial dimensions of health and disability in older adults. She teaches our geriatric patient care skills and professional engagement content within the curriculum. And Gautam Singh is our professor and teaches our foundational science coursework. He has his PhD in physiology from the University of Louisville and is actively involved in research there at U of L, doing non-invasive neuromodulation to promote motor recovery in children with spinal cord injury. So again, he teaches our anatomy and pathophysiology content to our students. We also have three main adjunct faculty, Jade Burnett, who teaches our neurological content as well as our foundations of movement science. Cassidy Brown assists with neurology content, our special populations and diagnostics and pharmacology. And Arsenio Paez does our foundational neuroscience and research coursework. And then you. So our clinical educators are so crucial and important in the role of developing our students into physical therapists, and we appreciate all that you do. We um, also, want to help make sure that we are supporting you guys. And so if there's anything that we can do as far as continuing education that you're interested in having us offer to you, we would love to provide those resources to you. I'll be sending a little gift your way as I visit you all during the rotation. And there is an opportunity if you guys are interested in having access to our Access Physio, which is basically a collection of all the textbooks that we use throughout the curriculum. So if you have any interest in that, if you contact me or reach out to me, send me an email, I'd be happy to get you access to that throughout the time you're working with our student. So just to give you a little bit of an overview of our program structure, since our program is new, this probably is the first time you're taking a Spalding student. Our academic year begins in August. You will be working with our OGs. It is a fantastic, dedicated group of students. I have been so impressed with their growth and professionalism throughout their time at Spalding. We currently have 3 cohorts and will receive full accreditation in 2026. The way we are structured is we're kind of more of a longer length program. So it's meant to provide a little bit more flexibility for those students that may have other things, in their life, whether that be work or family. But we have our students graduating in May of 2027. So this cohort that you will be working with is graduating May 2027, but they're in their third year. So they've really had a significant amount of their coursework that they've already done. And we'll go into specifics a little bit more shortly about what they have done. But we have a hybrid model of teaching. So what that means is for 3 weeks out of each month, students have asynchronous content, whether that be lectures, assignments, quizzes, things like that. But something that makes Spalding special and our program special in our hybrid format is that we have synchronous sessions with our students each week for each course. So that's a time when students are expected to come to that course prepared to apply the knowledge that they've learned within that module. And, have it be more of an interactive session. And then our labs are for 1 week, pretty intense. They're 8 to 4 every day, and they're in person. Something that is really nice about our program is that our class sizes are smaller. We're not having like huge groups of 100 students. Again, we're for a new program, so fewer students, but it allows more personalization of that education for students. So why the hybrid approach? So I just talked about this a little bit earlier briefly. It just allows that greater flexibility in the student's schedule. They can kind of learn on their own time. Again, I know the hybrid model isn't perfect for every learner, but some learners really thrive in this setting. So And then actually, to answer your question on class sizes, so right now this first cohort has 9 students in it. So they're pretty small, but we can get up to, our 30, 40 students right now. We are gradually growing with each year. Our incoming class right now is 10. And we're seeing numbers pick up right now. So we're hoping to have a class of 20 in this next incoming year. Um, we have learning in various different forms. So thinking of this hybrid approach, we do a lot of computer-based simulations and videos, lectures, and assignments that you know make for more active experiences for our students while they're not with us. And students are able to live, throughout the United States and attend our program. So we have students that live in Florida and Missouri that come into Louisville for a week every month. So it kind of makes things a little bit more flexible. Another plus of our program is that there's no bachelor's degree required. So students can enter as long as they've completed all their prerequisite course with 90 credits. And their first year PT school would count as their senior year of college. So then they would get that bachelor's degree in health science and then progress through the curriculum and be done with their PT degree in a little bit over 6.5 years. So, all right. So my mission and our mission for clinical education is that our students demonstrate a sufficient scope and breadth of activities in their professional practice experiences really across the continuum of care. So they're seeing patients in all different settings of all different ages and diagnoses. So for an overview of our clinical education, we have four main experiences that are full time. Now, throughout the program, there are various integrated experiences, but I'm just focusing today more on their full time experiences. So, students have already completed their first experience within the fall of their second year. So, this was last fall. They did a 4 week rotation full time in the outpatient orthopedic setting. And right now, they're coming to you in the fall of their third year for a full-time 8 week rotation, and they're in the inpatient setting. So whether that be in acute care or in the skilled nursing facility. And our third experience is more neurologically focused. So our students will be doing that in the summer of this academic year. So that's 2026. And their last experience will be in the spring semester of 2027. So that will be right before they graduate. Something that is unique about our program compared to other hybrid programs is that we don't have our students do any other coursework from any other classes when they're doing clinical education. We strongly believe that students need to be focused on what they're doing in the clinic and making sure they're preparing for the next day and doing any assignments that they may be given by their clinical instructors during that time, so they can perform to the best of their ability. So, just to run through quickly our coursework and what our students have already done, content is really organized into 10 basic themes. So, you'll kind of see me talk about these as I go through. But the first is foundational basic science, and then introductory patient care skills. So, you'll see these right away that human gross anatomy is that foundational basic science, our foundations of neuroscience. You're seeing that in that first year. The applied physiology, again, that foundational science. The patient care skills. So we got patient care skills 1 and 2. That's when our students are learning about things like how to do transfers, how to do gait training, making sure they're using good safety practices with hand washing and sterile fields. They're learning things like goniometry and manual muscle testing too, as well as modalities. They also are learning that foundational neuroscience coursework, and they also are getting cell systems diseases. Our foundations of movement science is kind of more of that kinesiology, and then basic motor learning principles. Our diagnostics and pharmacology coursework is split up into 4 courses. So it kind of revolves around whatever content area they're learning at that time. So For example, the first year is more focused on the musculoskeletal content related to diagnostics and pharmacology as they begin to learn that musculoskeletal content at the beginning of their second year. And then critical inquiry is woven to throughout the program into 3 courses. So as you can probably see, and you'll see as I introduce how our curriculum is set up, typical courses that may be given in one semester of PT school are maybe stretched out into 2 or 3 semesters. That second year coursework includes our foundations of patient management. So, beginning that screening process, understanding different screening tools and techniques. Our critical inquiry continues. Our professional engagement, so professionalism, ethics, all of that. This is where we get deep into more of that clinical content. So, that musculoskeletal, cardiovascular, and pulmonary. They're getting the diagnostics and pharmacology related to cardiovascular and pulmonary. Um, Conditions, and then integumentary physical therapy, and they begin with their neuromuscular content. And then our students that are going to see you right now, they are just finishing up their coursework in geriatrics, special populations. So that's things like pelvic health, workplace injuries, concussions, cancer, or oncology. Those are the conditions that are covered in that course, and then professional engagement. So, what did the students do while they were out there on their first rotation? So, what are expectations during that first rotation? What they've already done was that they're able to introduce themselves, have conversations with patients, make sure they're able to create a safe environment for both themselves and the patient, and assist or complete themselves the subjective history when doing evaluation and treatment. They should be able to, and they show that they were able to complete a basic treatment note and assist in evaluation notes. We talked a little bit earlier about their content included manual muscle testing, goniometry, those modalities, and gait instruction. So we expected those things, and those things were shown during their first rotation. The gait analysis, the functional movement analysis, they did palpation, and then also did integumentary exam. And again, their work was in the outpatient orthopedic setting, so it's going to be different than the acute care setting. But obviously, a lot of translational skills that are needed in both settings. And again, we were seeing our students work with more of those less complex patients. So, what we really expect our students to be doing with you all is that we want them, especially by the end of that rotation, to be able to do a thorough chart review and including interpretation of any diagnostic imaging or anything related to that patient's case. Obviously, those electronic medical records are very different from place to place, so they'll need some guidance on how to manage and get around with that. But something that we expect them to be doing very independently by the end of their rotation. They should be able to do a subjective history and systems review with patients for non-complex presentations, and then also do examination and treatment for patients with any simple musculoskeletal, cardiovascular, and pulmonary, integumentary, geriatric, or neurological conditions. So feeling like it's pretty independent for them with those simple patients. But when it comes to those more complex patients, that's where they still may need quite a bit of assistance or some assistance to successfully complete an evaluation or treatment. So for clinical education, we use the exact portal. So I know that a lot of PT programs use this, so hopefully you're a bit familiar. Hopefully you have all received, I know I sent out a while ago, access to that exact portal. And please just shoot me an email if you have not received any access to that. But that is kind of where everything under the umbrella of clinical education that you and your SCCE will need will be within there. So if you are not familiar with Exact, it is just a portal for allowing me as a clinical educator and PT programs to really keep track of everything for clinical education. So that's things like site information and instructor availability, making student placements, collecting your evaluations and student evaluations, um, you know, allowing you all to have access to our clinical education handbook and any resources. And then tracking things like our compliance documentation. So, in compliance documentation, so things like immunizations, background checks, and drug screenings. So, what I'm going to do is I'm going to share our site. We have a site resource page, which has lots of information that I hope you will all find is helpful that you can use throughout your time working with our students. So I'm just going to make sure that this is popping up on your screen. And I'm going to just change where I am sharing. So just to kind of show you through our site resource page. So this is just kind of your entry screen, your main screen. And things I'm going to point you to are the places where I feel like they're the most helpful information. So, if you ever need to contact me, my information there, email address, and phone number are right there. Please don't hesitate to reach out to me at any time. Our clinical education schedule, you can look at this, but I feel like it's a bit confusing. Um, the the big thing to pay attention when you're looking at this is just what year the course is done in. So obviously we're going to start with professional practice 1 and progress to 4 as there are 4 courses. But kind of just looking at that year will give you the exact dates of when those rotations are completed. And then the big source that I feel like you guys will find to be helpful is our program-wide resources for clinicians. And then I'll show you the course-specific ones. But the program-wide resources for clinicians includes our clinical educator handbook. So there's a copy of that if you just click that button. Our information about the clinical internship evaluation tool. So that's something we're going to go over in our next few slides after we get through this basic introduction to exact. But that is how we are going to have you all and our students assess themselves. So if you're not familiar, it's an equivalent of the CPI, but I have found it to be a little bit more short and sweet and to the point, which is really appreciated. As a clinical instructor, I really appreciated that. Next is form. So student goal writing worksheet is something that I'm just going to click on and show you all real fast. It's just something that the students are very aware of. And hopefully they'll come up to you with this on the first day. But it's just a way to kind of have that introductory conversation and talk about what students' goals are and for their rotation and kind of what they're trying to, improve upon in their education as they wrap up their education in physical therapy school. Kind of things that they feel like they have made progress in, maybe in their previous rotation, how they like to get feedback, whether it's just right after they see a patient, or whether that be almost in the middle of seeing a patient, or whether that be kind of a summative time when they have a wrap up, a couple of hours later, what works best for them, and how they were prefer to receive that feedback. And then, talking about their areas of strength and where they'd like to develop. So this can be a helpful goal writing sheet that can be used time throughout the rotation. Another one, which you're probably familiar with, is a weekly goal writing form. So this may be a little bit different than those. I believe the APTA has one through some of the courses that they do for clinical instructors, but this is more specific to different areas of skills. So having assessment of the student, talking about kind of their communication areas and needing improvement, how they're doing with that, their evaluation skills, the treatment skills, and the affective domain. So kind of talking about what they did, what they had, the opportunities they had to do these different things, and then talking about those areas where they felt that they performed strongly, and areas that they needed to improve upon. And this is something that you and the student can do together. Or, you could do it separately and then come together to discuss these things. And then together write those goals for the next week. As a CI, whether it be a student that was really excelling or a student that I had difficulty, that was more difficulty with, what we were doing within our rotation, I found it to be really helpful on both ends. And our students are familiar with these, and there's actually a form in Exact that you can document these weekly planning sessions. So, if you would just prefer to do it electronically and just click the buttons, it may be a lot easier to do it that way. But that's a resource that's available to you through Exact. I also have a critical incident student learning plan that needs to be completed if there is any critical incident that occurs during their rotation. So, those are things like serious breaches of professional behavior, ethical standards, or patient safety. So, things that I need to know about right away because this jeopardizes the student's ability to successfully complete and, most of all, provides safe patient care. So again, please reach out to me right away if any of these incidents happen, as I need to be a part of this process. But I do want to let you know that there is a process that we have and just how that process works. Hopefully, we don't have to worry about any of this. But if that does happen, here's the place to find those resources and information about that. I'm not going to go into depth about this because we will be in communication if this does happen. I sure hope it doesn't, but we will be in communication about this and go through it. The other place that you'll be filling out, and we'll be working to fill out something together, is that critical incident student learning contract, which is right here, which just basically talks about and is documentation for showing what exactly happened, what the pitfall or shortfall in the performance was, and an expected standard, as well as improvement actions. So, teaching resources. So here, a bunch of resources. I know you all are incredibly busy, but if you ever I feel like I would love some resources to just brush up on my skills for teaching and being a clinical instructor. These are some great free teaching resources, some through the Ohio Kentucky Consortium. There are some videos and even a free course through the University of Michigan about teaching and assessing critical skills. And then lastly, Exact resources. So in addition to this completing the CIET and training for CIs, this is just a link to a information sheet. They have lots of videos and information sheets for just about everything under the sun. I'm happy to point you in any direction and help assist with your accessibility of Exact. But there's also a wealth of videos as well as handouts that can help you to better access the Exact portal system. And then course specific. So under course specific, if you're looking for our course, this is where it can get a bit confusing because you'll see we're in professional practice too, but there are two courses. So you'll just want to make sure you're under the correct year. So it is the academic year of 25-26. So we have fall 25-26. I'm going to click on that. And here's where we have some of those same resources that I showed you previously with the introductory goals, the weekly planning form, and those critical incident reports. And then I will send this out to you all. This is going to be a very helpful document, but this is a clinical educator overview, which has basically our coursework with descriptions of what courses have been done, information about communication with me, and our clinical instructor task. So this is just a timeline of things that we're going to have you complete while you're working with our students. Student tasks. So we'll talk about this a little bit more, but just so you know what they are responsible for doing, I will be on top of them. So it's not your problem, it's mine. But just so you know, this is what the students expected to be doing, and they will be coming up to you with some things for you to do for them, just so you kind of know the general time frames of that too. That's good. I feel like I am talking so fast and rushing through, so I'm going to just break for a quick second. And does anybody have any questions? Okay. Well, what I'm going to do is go back and share my PowerPoint presentation here. Um, oh, okay. So, we're talking about the clinical internship evaluation tool. So, if you all have not worked with the clinical internship evaluation tool, basically what it was is a form that was developed and validated in 2007 to evaluate the skills necessary for clinical competence and provide more of a short and easy to use format for CIs. So it's to basically evaluate the student physical therapist performance relative to that of a clinician who is effective, who can effectively and efficiently manage his or her patients and clients to achieve optimal clinical outcomes. So you'll hear this definition go over and over again. And I like to have my students, I say, like, put this on a card right in front of you when you're doing your assessment, because that's what you're comparing yourself to. So just thing important to be aware of and kind of think about when you're doing these assessments. So why do we use a CIET and not the CPI? So I talked about this a little bit earlier, but we have it's pretty easy to use. It's just one form to fill out instead of several linked forms. You've just got one page that you're working with. There's a little redundancy in the items. I remember the amount of times that I felt like I was repeating myself when I was doing assessments for students during the CPI, and I do not feel like that is such an issue with the CIET. It takes significantly less time to complete. So I'm going to show you a little bit about that. And then the scales for grading are better defined. So, um, you know, instead of entry level, we're more looking for a student that is at the level of a competent, cost effective, and effective physical therapist. So here is a little bar graph. I love pictures just to show the difference in time that it takes for both clinicians and students to complete the CIET and CPI. So that blue bar is the CIET. So you'll see that over to the side. So it really takes most clinicians anywhere from 30 to 45 minutes or clinical instructors, 30 to 45 minutes to complete the CIET. When we're looking at the CPI, it can take, the vast majority, they're taking more of 45 to 75 minutes of time to really create or complete that CPI, which is very consistent with my experience personally. So this next bar graph just shows a preference between clinical instructors and students and what they prefer between the CIET and the CPI. And the bar at the left shows the CIET. The blue is for the CIN student, the orange is for the CI, and the gray is for the student. So you'll notice that about 70% of the students and CIs prefer the CIET versus the CPI was preferred by about a little over 20% of the students and clinicians or clinical instructors. So pitfalls of the CIET. So there's less research. It's a newer tool, and it's definitely not as well known as the CPI. And a lot of CIs, some CIs may not have used it before. So there is definitely a learning curve. So the CIET is split up into four sections. So it's for professional behaviors, standards for patient management, comments on areas of concern or strength, and then a global rating of student clinical competence. So those standards for professional behaviors are those things like safety, professional ethics, initiative, and then communication skills. So safety is very similar to that of the CPI. We're making sure that they're following all health and safety precautions at your facility, and making sure that patients are treated in a safe fashion. Professional ethics addresses the student's knowledge and compliance with any rules, regulations, ethical standards, and legal standards, as demonstrating a professional appearance and conduct in the clinic. Initiative addresses the student's ability to maximize all opportunities for learning during their clinical affiliation. So they should show that they're beginning to be able to problem solve independently. They seek out and accept as well as implement constructive criticism and develop teamwork and flexibility in that clinical setting. And then communication skills, where this definition is a bit more broad, as it includes not only the verbal communication between the student and patients, family, and other healthcare professionals, but it also includes that documentation and written skills like home programs or any other required paperwork. So the professional behavior grading is on a scale from never, which is it never occurs, zero occurrence, to always, which is more than 95% occurrence. The only one that you are able to say not observed is for communication. But this shouldn't be an issue for any of you all needing to use that during this rotation. But from the onset of our students' clinical experiences, we expect that our students show safe and professional behavior and demonstrate a great deal of initiative. So we really do expect that a student, is always demonstrating professional behaviors in the clinic, with that exception of clinic communication skills, which is going to be developing throughout their clinical education experiences. This is kind of a copy of what you'll see on that exact portal when you're completing the CIET. So you'll see this is just a sample student form. But under that safety, so we're thinking of standards of professional behaviors that we just talked about, there's different sections. So safety being first, you'll have to rate different objectives and skills or characteristics as well for the student on that scale that we just talked about. So you're just clicking a box. Pretty easy to go through that. Here's another just kind of more of a close-up of that. So you can see that student midterm rating and also the CI midterm rating. And if you all are familiar with the CIET, have done this before, this is something that has changed really since last year. Is this 2.0 version allows you as a CI to complete the CIET at the same time as the student. So you don't have to wait for the student to have completed it first and send it off to you. They will send it off to you early on, and I will make sure they are on top of that. But don't hesitate to reach out to me if you have not received access to that. At least a week, hopefully more in advance of that midterm and final. There is a place for comments on those professional ethics. So each area, I encourage my students to write, make some brief comments just about areas of growth and areas of opportunity. All right, so that's standards for patient management. So this is going to be the stuff that's a lot more straightforward to you all when we think about examination, evaluation, diagnosis, prognosis, and intervention. So thinking of that examination is obtaining that history, systems review, and performing tests and measures. The evaluation is that analysis and synthesis of the data gathered to determine a diagnosis and plan of care for the patient. The student should demonstrate the development of their critical thinking skills during the evaluation process. The diagnosis and prognosis should be more determining a diagnosis for physical therapy management. So, not that medical diagnosis, but also determining that prognosis or outcome for that episode of physical therapy care, determining that appropriate frequency and duration of care, as well as any criteria for discharge, and also determining any appropriate treatment. And then that intervention would be a student's ability to apply the treatments, perform any patient and family informed education, and monitor a patient's response to treatment, as well as adapt accordingly. All right. So for patient management grading, students are compared again. So this is that definition that we talked about earlier to a clinician who is able to skillfully manage patients in an efficient and effective manner to achieve an effective outcome. So they're rated at well below, below, or at that level for familiar patients. So when we say at that level for familiar patients, that means more of those simple patients with not a ton of comorbidities or complexities. This is something that they probably learned about in their didactic curriculum, or they maybe seen with you a little bit earlier. So something that they could more more of a simple patient, right? Those complex patients or presentations are those that are suggested when we say at that level for all patients. So those can include a patient or problem diagnosis that is rarely seen or something that the student did not cover within their didactic curriculum, a diagnosis that is really complicated and has a complicated course of care, or a complex medical history. So also it's important to really think as you're grading these students in the patient management grading is how much are you supporting them in the care in that specific area of treatment or evaluation. So, are you really providing a lot of support? So, they're maybe needing a lot of support for when they're at that level for all patients. So they really may be more of that level for familiar patients. Okay, so again, places for you to write overall comments. So this is just related to overall, how's the student progressing? At the midterm, maybe things that you'd like to see them improve upon, opportunities, things that they're really, you see as strengths for them. A global rating of student clinical competence. So this is 0 to 10 scale, 0 being well below a competent clinician, and 10 would be well above a competent clinician. So here we're just looking for an improvement upon midterm and final. So they're moving up in those numbers throughout their rotation. And then at the end, you'll be cued to write, is the student performing at a level that is satisfactory for their level of education? So this is something that helps to red flag me and let me know if, wow, I really need to intervene right now because they're not showing satisfactory performance. And then we have a digital signature. Okay. So these are our general expectations, what we expect our students to be performing at, the levels we expect them to be performing at and showing on the CIET by the end of their internship. So for professional ethics, we expect them to be always under the standards for professional behaviors. Most of the time should be for the safety, initiative, and communication. At that level for familiar patients should be for any skill under that patient management on the final CIET. You should show improvement, as we just talked about earlier, on that visual analogy. So that should be from the midterm to the final. And then they should show satisfactory completion of an in-service activity or presentation, which we're going to talk about next. So our students are expected to provide something that helps you all and give back to you as you're doing this fantastic service for us and helping to educate our students. So our goal of this activity is for our student to assist in the clinic in improving function or assist with the translation of knowledge to clinical practice. So I'd like the student is expected and to discuss this topic with you and get input on something that would be helpful before it is completed by them. And then what I'm going to have you all do is complete just a basic assessment for me. So if it's an in-service presentation, I'll have you just write, your responses, whether the student presented the information in a clear and organized fashion, things like whether they were knowledgeable, just how the presentation was overall. And this form isn't exact. I'll have you fill that out in exact too. And then just if it's a project, there's just some different criteria that I'm looking for. So next, additional evaluations. So these are other things that you may be involved with, that you'll be involved with throughout the clinical education process in the students' rotation. So the PT student evaluation of clinical instruction. So this should be probably very familiar to you all. So you'll do this at the midterm and final and review that with the student. The PT student evaluation of the clinical site. So that is only done at the final and will be reviewed with you, the CI, and signed by both of you. And then so important to me is the clinical instructor evaluation of me and our educational program. So I cannot tell you how helpful it is, especially having a new and developing program, to get the input of you all where you feel like, we're doing well, but those areas for growth and opportunity, anything that I can do to make your experience better. It's so helpful for me. So please never be shy and never hesitate to reach out to give me feedback because I so appreciate it. So your homework. So this is in a handout for you also that I will send to you, and I will give you access to the slide and presentation. But you'll have to do your CIET training and the quiz on exact by October 20th. You will have to do that before you're able to complete the CIET assessment for your student. The CIET midterm is due the 19th of November. The in-service presentation project evaluation will be due December 12th. The CIET final should be submitted by the 17th of December. And then the CI SECE post-clinical questionnaire, so giving me an assessment of my performance. So important to make sure that you do that as well. So recommendations for success. I know that you guys have all very familiar with the process and with clinical instruction, but just making sure that you introduce have an introductory conversation with the student. I always feel like setting expectations, not only with our patients, I've learned, but with students is so helpful in improving outcomes. So just making sure that they know what you're expecting of them. I expect you to come 15 minutes before the day to review our patients. I expect you to have the gait belt and the walker ready to go at 8 o'clock because we're going to see our patient. So anything that they need to do, just have those introductory conversations to get to know each other. Also, something important that I'm telling my students to talk to you all right away is about the Thanksgiving holiday and how that falls within their rotation. So just making sure that if you are working that day, they are responsible to be there with you. And if you are not and need to make up that day, they are working the weekend or whatever days that you're working to be doing what you do. Giving them a tour of your site, making sure that they're familiar with where they need to access everything. Constructive criticism. So not just, again, giving them criticism, but giving them, this is how I would do it, is very helpful. And then giving your rationale to why you would do it particular way, but also guiding and assisting them in that clinical reasoning and kind of taking them through your thought process. So, what assessment would you do? Why would you do that? What are you looking for? Those questions are important for these students to help them really figure out how to do that on their own. And then frequently reviewing your objectives, what you're trying to complete that week, and what you're expecting the student to do this week can be really helpful in improving their performance. Okay, so trying to wrap this up quickly here. So, observation experiences are so incredibly beneficial for our students. So, if you have the ability to allow them to shadow, um, other disciplines, surgeries, any especially areas of PT practice, or even multidisciplinary care or especially clinics, that can be so helpful for these students because it's not always easy for them to see. Definitely in our didactic curriculum, it's they don't get that. So it's very important for them to see that while they're out on their rotations. And then also working on that supervision and coordination with other staff is so important too. So I will be doing a site visit and I will be emailing you all shortly to get that scheduled. But what we can do is meet either in person or via Zoom, whatever you prefer. I personally love going out to clinics and hospitals and meeting you all in person. So that's definitely my preference. But I know you all are strapped with busy schedules. So you're going to meet with me individually, and then I'll also meet with the student. And then we'll meet together just to make sure everything's going well. But please, please, please never hesitate to reach out to me if you have any concerns, any questions, you just have this hesitation, feel like, oh, this might be an issue, please reach out to me anytime. Here's my contact information. I am here to be a resource to you. Um, so that is all of my presentation. But does anybody have any questions, anything that they would like to discuss, any resources that they would like, or anything I can do to help you all with this experience? You all are a quiet group. Awesome. All right. So I know I'm the type of person that I have about 50 questions after the fact. So don't hesitate to shoot me an email if any questions come up. I am so excited to meet and work with you all and so appreciate the education you all are providing for our students. I am going to send you all of course, evaluation, basically to help me know how I can improve, any more information I can give to you all. And again, that assessment at the end of this rotation will be so helpful to help me grow and better be able to serve you all. But again, thank you, thank you, thank you for your time and spending the time during your busy clinical day to chat with me. And I hope you have a wonderful rest of your day. All the time.